Are you currently pregnant and wondering what the heck position your baby is doing within your belly? In this video, we're going to break down how to do belly mapping and how to figure out what position your baby is in. Welcome to the MamasteFit YouTube channel. I'm Roxanne. I'm a student midwife and labor and delivery nurse of over 9 years, and we're going to break down how to belly map, which means like how to figure out baby's position inside of your womb based off of different things. Belly mapping is not just a tool to figure out what position baby is in your belly, but it's also a really great bonding tool to use to figure out where baby's kicking and talking to baby as you're doing all of these things to help increase bonding. When your baby is head down, there are different variations of this. So baby can be facing either to the sides, up, or down. So if you think about your baby's head is a compass, and the arrow of the compass is the back of your baby's head. So where baby is facing is not the front of the compass, it's the back of the baby's head. Baby can be facing either to your left hip or to your right hip, but when they're referring to the position of baby, they're going to be talking about the back of baby's head. So OA or OP is referring to the occiput of the baby's head. So if you commonly hear providers or nurses talking about your position of your baby and they're saying baby is LOP or LOA, they're talking about the back of the baby's head and where that is found in your pelvis. The most common terms are OP and OA. So this is an OP baby. So the back of your baby's head is posterior on your posterior side. So they're facing straight up. An OA baby is where the back of their head is anteriorly or to the front of your body. So they're facing towards your back. For me as a labor nurse, when I do belly mapping, I'm putting my hands actually on the belly and I'm going from a top to bottom fashion. This is called Leopold's maneuvers, and many of your providers may do this as you get closer to term just to see what baby's doing as well as maybe assess how big baby is. This step can be the same things that you're doing when you're doing belly mapping, but we're going to add in a little bit of extra stuff that you can do. The first thing we're going to do is assess what is at the top of the belly. It's easier to do belly mapping in a reclined position, especially if you're going to be touching the belly because you're not going to be activating your ab muscles. You're going to be more relaxed and able to actually feel the parts of baby. So again, we're going to start at the top and we're going to feel what is at the top. Is it a head? Is it a butt? And the difference of a head and a butt, if you touch your own head, it's really hard. If you touch your butt, it's still semi-hard because there are still bones there, but it's a lot squishier. So is this part up here squishier or pretty hard? Sometimes they feel the same. I'm going to be honest. But if you then grab that top portion and kind of wiggle it, does the whole body wiggle or is it just the part that's wiggling? If the whole body wiggles, likely it is a butt. If just the top wiggles, it could be a head. Just like if you were going to wiggle your head, none of my lower body is moving. But if I wiggle my butt, like I have to wiggle my whole body. Same with babies. After you determine that this is a butt at the top or a head, if it's a head, you're again going to go down the sides. Ooh, look at that leg. So now you're going to go down the sides. I usually will place both hands on both sides and just feel with one hand at a time to feel, do I feel something smooth or is it more bumpy? If it's more smooth, like it is on this side, that is likely the fetal back or baby's back. If you feel and it feels more bumpy or you can actually feel parts, so like sometimes like right here, I can feel a leg or a limb of some sort, or further down, I also felt a limb a little bit down there, then this is likely baby's actual limbs. So their fetal parts is what we'll call them. So likely baby in Gina's belly, butt was over here. I felt limbs over here. And on the other side, behind this baby is where I felt the back. So baby is likely in the position like this. Maybe facing the hip. We'll get to that part. But this is what I was feeling inside Gina's belly, but on the outside. For you to figure out where the fetal back is and where fetal parts are, you can determine this by just feeling where do you feel kicks. Likely Gina feels kicks all on this side, whether up here or even the punches down here, but it's on her right side is where she's feeling more kicks. And then where do you feel hiccups? If you feel hiccups more in this lower quadrant or this upper quadrant, that's likely where baby's back is. Just like when you have hiccups, you're having hiccups like in your upper back area or even upper chest. That is where the baby's going to feel most of the hiccups as well. So where baby's upper back is located, that's where you're going to feel those hiccups on your belly. So it's going to be near the head. So if baby is head down, you're going to feel these hiccups in the lower belly. If baby is head up or butt down, you're going to feel the hiccups higher in their belly. So after you determine where the fetal parts are and where the fetal back is, so baby's limbs and baby's back, then we're going to determine what part is actually entering into the pelvis. And are they in line with the pelvis? Are they engaged? Are the next things that we are assessing as providers. You do not need to necessarily do this. All you really need to do is just feel in that area to see what is down there. Is it a head? Is it different than what feels at the top? Or what if when you felt up here, you didn't feel a head or a butt? And down here, you didn't feel a head or a butt. That means baby could potentially be transverse. So that would give you the sign that maybe baby's head is over here or over here. And this is a transverse lie position. Not to be confused with OT or transverse presentation. That means that baby is presenting in a transverse way where they're looking to the left or to the right. So for me, I'm feeling down here to see where is this little head? There it is. And that is a lot harder than what was up here. This is still hard, but way squishier than what's down here. The next step, I'm not going to do crazy amount, but this is where we actually feel for is baby really engaged. This is where you're going to put your hands on either side and almost kind of like press around the baby's head to see if baby will come up. I'm not going to press super hard because it's not super comfortable. But that will give us an idea of can we feel if baby is in a extended position or more flexed position, as well as are they fully engaged into the pelvis. Again, not something you necessarily need to do yourself, but your provider may do when you go in for an appointment. So just to recap, things that you can do at home to feel and bond with your baby to figure out their position. Number one, feel, is it a head or a butt or neither up at top? Then you move downwards, either with your hands or just feeling for movements and hiccups. Where is the back of baby and where are their limbs? So where are you feeling kicks or where are you feeling hiccups? Or when you go in for your appointment and they're listening to baby's heart rate, where do they get baby's heart rate easily? Because again, that would be the back of baby's up at the top. So if they're getting it down in the lower quadrant, baby is likely one head down, and then you know the opposite side is likely where their like limbs and arms are. The last thing that we would do is one, just feel what is the presenting part. So what part is entering the pelvis? Is it kind of engaged? And then we would see if we can like feel whether or not baby is extended or flexed in with their head. But this is not something you necessarily would do. Your provider would be more likely to do it. Not all providers are super skilled in hands-on assessments, so asking your provider to see if this is something that's within their scope if you are wanting them to do Leopold's maneuvers. So belly mapping or a Leopold's maneuver is a really great way that we can assess baby's position from the outside without needing to necessarily use an ultrasound or do a vaginal exam. So this can be done during pregnancy or even during labor, or something that you can do at home just to help with bonding with you and your baby. This is also something that you can do with your partners to help increase bonding, not just between the two of you, but also with them and their baby. If you're looking to learn more to prepare for childbirth and learn ways that you can support baby's positions with movement, check out our online childbirth education course, where we break down not just the science of labor and birth to make it less scary, but also different laboring positions and movements you can do during labor to help your baby reposition and move through your pelvis to be born. And you can check out our online childbirth education course at MamasteFit.com and use code YouTube10 to get 10% off. If you enjoyed this video, please like and subscribe to our channel so you can be notified whenever we release new videos. We release 1 to 2 educational videos a week and 1 fitness workout video a week.